10th of May every year is set aside as the National Safe Motherhood Day in Nigeria. And I think it is being commemorated at least usually throughout the week. But I have here with me Egboh Salako sitting very close to me. Let me be gender sensitive now because we are talking about women. Egboh Salako, State Team Leader, Nigerian Urban Reproductive Health Initiative. You're welcome, madam.
Thank you very much.
And thank you for coming on EM Express. And I have here with me Mr. Mike Egboh, National Programs Manager, Partnership for Transforming Health Systems. You're welcome.
Thank you very much.
I'm glad to have both of you here. Now, what are the issues confronting safe motherhood in Nigeria? Let me start off with you.
Well,
and how does your NGO come in to help?
Well, when I discuss safe motherhood, I always like to start with my story.
Okay.
Because I lost my mother in the labor room.
Oh my God.
I've told this story and I'll continue to tell it. And I'm in this business today because she died that way, so that other people don't die that way. Having said that, after several years of programming, you know, it's still a shame that Nigeria still contributes 10% to the world global burden of maternal mortality, despite the fact that we're only 2% of the world's population. So I would say for Partnership for Transforming Health System, which is the organization I work for, the project I work on, we're into strengthening health system to ensure that people have access, the poor have access to quality health services, including safe motherhood. Specifically, we are working to make sure that we have trained providers. We're making sure that we have people don't, one of those three delays, you know, transportation, that there is transportation, for instance, in Kaduna State and in the states where we work, we have emergency transportation scheme where the road transport workers have pledged themselves to support the safe motherhood scheme so that if somebody is sick, they're able to take that person. And they're also trained on how to take them from their home so they're not just driving like rough taxi drivers. You know, they're giving those skills, they're giving first aid skills so they can get these mothers home from the rural areas, and traditional institutions are involved. And we're also, in our project, using anti-shock garment. Anti-shock garment is that prevent postpartum hemorrhage, you know, that enables the blood to be stored in the vital organ areas, you know, to enable you transport that person to the hospital. So we're working in health centers to do that and other services. Okay,
it's good to know that there is an NGO in charge of that. Now, Mrs. Salako, you heard him say that, you know, he talking about his experiences, and before we came on set, you were telling me that you are working in the urban slums. Now, is there a relationship between, you know, providing the basic amenities of life and safe motherhood?
Yes, definitely. There's a relationship. The organization I work for, which is the Nigerian Urban Reproductive Health Initiative, is a 5-year project in Nigeria, where we do realize that a lot of the poor people are trying to move into the urban to see what is there. What is that gold lining streets that is in Abuja? And so we discovered that from the projection we have had, come the year 2035, 50% of the poor will be living in the urban. And so we want to cash in on that, to try to sensitize these poor people, these people that you scarcely think about when you are talking about the people at the grassroots. They are the one moving into the urban. And so we know they don't have the basic amenity to live. And, you know, when you're talking about the facilities are not there for them, the housing, the sanitation is not there, the condition is not conducive. And so when these people bring up children, you know, without spacing them, there's possibility of them losing their life, the mother, or the child, and then the family is affected. Because when a woman's life is lost, definitely that child might lose that life, and then the family is not together again. And when the woman try as much as possible to space the pregnancy time, then you are thinking about that woman being able to take care of herself, being able to bring in some little economy into the household, and so they have a good home. And that is what my organization is catching in, to be sure that these people are sensitized. And we are not only working in the facilities, we are working with the traditional, we are working with the religious group, we are working even in the area of advocacy, trying to get to the key stakeholders that are responsible for these people to know that family planning or childbirth spacing, healthy timing is critical into the attainment of a good, safe motherhood and, of course, the Millennium Development Goal. These are just our projects.
Thank you. Now, Mike Egboh, let's talk about traditional practices, because putting up all the structures and making all these efforts only depends on acceptability of what you are going to preach to people. Now, our tradition itself, what is the approach of it to save motherhood?
Well, thank you. Again, I have worked with traditional leaders. I have worked with traditional birth attendants. Actually, we developed a module for training traditional birth attendants. Unfortunately, that module was developed in Kano. The government accepted it. The Sudanese government also borrowed from us. If you go to Sudan, you find it everywhere. But if you come to Nigeria, you won't find it everywhere. Coming to your question, we have traditional practices. We have traditional beliefs. We must understand that the level of education does not mean that you do away with traditional practices. If you go to traditional healers or traditional birth attendants, you meet people with PhDs because they believe that mama will do it in a way because it's been delivering for the past 50 years. Okay. And so they trust them. So, but what we need to do and what we have done is to give them the basic training so they understand how to refer. They understand their limitations so they can refer and make connection between the traditional practice and the clinical practice. We all take acupuncture, we all take Chinese traditional stuff. We can improve ours. You know, so there is that connection, but we must improve it because currently it's not well improved. We talk about it, but we don't work it. We don't ensure to make sure that it's working.
Okay, talking about, you know, talking it and not working it. Now, tell me about your experiences in the urban slum that you've been working with.
Very interesting. You discover that in the urban slum, these people actually believe in their leaders, either the traditional or the religious leaders. And that is why we felt the main entrance into dealing with these women and men. You see, we have gotten to a stage where we need to be talking that in the area of child spacing, the men play a very important role. And so we realize this. And that is why we discover that it is better for us to walk through the men. Our gatekeepers, they are the religious leaders, they are the traditional leaders. And when you actually get those people to accept what you are talking about, to know the importance of losing a life, be it a woman's life or a child's life, and what critical role family planning or childbirth spacing plays, the men kind of amazed. Oh, we can do something about this. Okay. And you see the women, once the men accept, the religious leaders can talk about it, and they know they have accepted, the women automatically follows. Well, okay. It's so amazing.
All right. Now, do you have a program lined up to commemorate today, Mr. Egboh?
Yes, let me before
briefly, yeah, because okay. Time is not.
Well, we have programs. There's going to be advocacy. There's going to be people being screened and people being counseled across the state. Each state is supposed to take their own program, you know, because it's for the benefit of the mother and child, actually. So there are programs throughout the week.
All right, all right. Thank you very much, Mr. Mike Egboh, the National Program Manager, Partnership for Transforming Health System. Thank you very much for coming. We've learned a lot. I wish we had so much time. Now, Mr. Debusola Salako, State Team Leader, Nigerian Urban Reproductive Health Initiative. Thank you so much.
It's a pleasure coming
Thank you.